Dr. Catado, I know that our
Yes, Tamara.
Yeah.
I'm one of the pediatric blood and cancer doctors. I know that you guys know you were referred here because of the lymph nodes
Yes.
and the concern that they still haven't gone away, essentially.
Right.
Okay, so just so I understand a little bit better, it looks like a month ago she had come to the emergency department.
Right.
She was complaining about some sore throat, it sounded like, and then swelling here.
Right.
At that point, I think they prescribed Augmentin then, right? But we didn't start the medication.
What medication?
Augmentin.
What is that?
It's like amoxicillin.
She
with
did. She
clavulanic acid.
completed that.
That's the one, yeah.
She completed that. The
When
antibiotic.
Yes. When did she start that, and when did she complete
She
it?
started the very day after the ER visit,
Okay.
and 10 days later she completed it.
Okay, good. So 10 days later you completed it. We didn't notice any changes in anything, in symptoms or anything like that, in like your runny nose or...
No, no
Okay.
change.
I got really itchy.
You got really itchy. Okay, but your throat didn't close up or you didn't have like hives or like big like rashes all over your body or anything. Okay.
No.
And then, so you finished it full 10 days, right?
Yes.
And then she went to her pediatrician, Dr.
The
Collins.
doctor.
Yes.
Mhm.
And that was 2 weeks ago, right?
Right.
And we still noticed we had the lymph nodes.
Still there, yeah.
And that point they started azithromycin, right?
She hasn't started that.
She hasn't started it.
No.
So she didn't, she wasn't prescribed any of that.
It was
medicine.
prescribed, but Carl said she didn't have to take it.
Why?
Remember we had the conversation with Carl. She was like, oh, you already took the antibiotics and nothing changed.
And that was 2 weeks ago she said that?
Right.
Yeah, she basically said it was unnecessary.
She prescribed it anyway, but she said she didn't have to take it.
Okay. But we do have cats in the house? Okay,
We
how
do.
many do we have?
2.
2, okay. Are they like kittens or cats?
Like
She,
cats.
she got one of them as a baby, as a kitten, 2 weeks
She's not-
old.
They're like a year old.
They're over like a year old now?
Yeah.
Okay.
Yeah.
But you have been like scratched a couple of times from them?
They don't scratch or bite or anything.
Okay. But I think you may have said that they do scratch.
Yeah, I have concerns that she probably did get scratched,
It's
but
okay
she's...
if they do. I
No.
mean, we're
They
just,
don't.
yeah.
They don't scratch. I'll pick them
Well.
up. They don't like it, but they don't scratch or anything. I've never been scratched by the cats. Except one time, a year ago.
Okay. But even like tiny little scratches or anything like that, or just like
Alright.
holding onto your shirt or anything, just like kind of hooking on a little bit.
No.
Even
don't do
like
that.
any tiny thing like that.
Don't do that.
Okay.
What? Because I want to know the answer. What's this all about? When Carl suggested that it could be cats, I jumped on that conclusion. Like, yeah, we have cats. As far as I'm concerned, they probably have scratched her, but she said they haven't, so I'm not
Okay.
going to argue with her about that.
Okay. Okay. Any fevers at home? Any runny nose currently?
A runny nose constantly.
Always. Okay.
Constantly. I mean, this has been going on for like years now. Last year, whole week.
Forever, yeah.
Yeah.
Just like chronic, not even allergies, like.
Okay.
We have seasonal allergies in the family, but
Yeah.
we treat them with Benadryl. We take it, it goes away, and then
Does
you
she
know.
take Benadryl or
She does, but it doesn't seem to help. You stop briefly, then she's back again. It's ridiculously runny. I'm surprised now it's not. Usually she has the stuffed tissues in there to keep it from.
It was this morning. It was terrible.
What
Yeah.
about like do you do Zyrtec?
We have done Zyrtec, we have done Zizol, we have done
Oh, yeah.
hydroxysil, prescription hydroxysil,
Okay.
we
I
have
did a lot. I had like Zoloft.
Claritin.
What was
Yeah.
the first one?
No, she's talking about the allergy stuff.
Oh,
Yeah. So are you taking any allergy medicine on a daily basis?
Benadryl.
It's just Benadryl, but what about like Zyrtec or Claritin?
We've done those before. None of them seem to work. Benadryl does work briefly. We stop the runny nose.
Okay.
But the other stuff should be on it, still runny nose.
Even if she's taking it on a daily basis?
Even if she's taking it. Even the hydroxysil. Hydroxysil is prescription, right?
Sure.
It didn't help at all.
Okay.
Claritin didn't do anything at all.
What about like a nasal spray?
We did that too. It don't seem to help either.
Are we doing that on a daily basis though?
the nasal.
Yeah.
We were doing it as prescribed
Okay.
at that time.
Yeah.
She's not doing it now.
Okay. Okay. Any I know that you said seasonal allergies, so any like other type of allergies like medicational allergies, animal allergies, food allergies, anything like that?
I was told to look out for like rashes when I started the
Let me
mental,
tell- yeah.
but I haven't. Nothing's happened.
Okay.
What if you're allergic to cats?
I'm definitely not allergic to cats.
Why?
Because my allergies have been around since before cats.
Yeah, she's right. She was like this before cats came along.
Okay. Did it get worse though when the cats came along?
It didn't get worse. It didn't get less worse. It just persisted.
Okay. I mean, it wouldn't hurt to if you guys were interested to be seen by an allergy immunology doctor to see if there's any other thing that they can recommend for like the constant allergies and if there's anything specific that she should be avoiding.
Okay.
Okay. And then so you said no fevers, no weight loss.
No.
We have a good appetite.
Yes.
We're eating okay.
Yes.
We're not skipping meals or anything like that. We're not like feeling nauseous or throwing up anything. Okay. No stomach pain. Okay. We're peeing okay. We're pooping okay. Okay. And we have nice soft bowel movements. Every day or every other day or how often?
I guess every day, every time.
Okay. You've never noticed like blood or anything like that? Okay. Any night sweats? So like when you're laying in bed at night, sleeping?
Not like abnormal. If it's like hot in my room.
Okay. But if it's not hot in your room, is anything happening? Okay. And then when you are like you've never like woken up and you're just drenched, like the bed is just drenched in sweat or anything like that. Okay.
That's happening to me now because I'm going through menopause.
Oh, okay, okay, but okay.
It's just terrible.
No ear infections or anything like that recently. Okay. And then I know that you said that there was your brother has colon cancer.
Yes.
And he was diagnosed when he was 20.
Yes.
How old is he now?
He's dead.
Oh, I'm sorry.
Mm-hmm.
How old did he pass away from colon cancer?
He did.
How soon after he was diagnosed?
When he was diagnosed, it was already stage 4. They did the stomach bag thing with hope for, it didn't help.
Okay.
He passed away shortly. Between the time of diagnosis and death, it was 2 years.
Okay. When was this?
A couple years ago.
Okay. Did they ever recommend for you guys, like, his siblings to ever get genetic testing?
They did, but we're Africans. I don't want to sound stupid or anything, but in my culture, we have diseases like everybody, but nobody ever talk about them.
Sure.
Forget about genetic testing for what?
Right.
It's a struggle enough to even go for, regular checkups and stuff like that. So yeah, there are problems in our family like depression, mental illness that people live with and die without even having been diagnosed or treated.
Okay.
So with my brother, he was sick for a while, having all the symptoms, but they attributed, maybe you ate bad food or maybe this and that and the other. By the time he went to the doctor, it was too late.
Mm-hmm.
So yeah, we should all get testing, but nobody has ever been tested.
Okay.
I have concerns right now, cancer concerns that I'm not for. I know I should be following through with my own situation. I'm not.
Mm-hmm.
And I know I need to. I have concerns with the breast, concerns with the uterus, cancer concerning.
And those are your own concerns? Has someone told you that there's something might be abnormal?
Yep, both with my breast and my uterus.
Okay. Okay.
Which I'm supposed to follow through. I have appointments scheduled. I haven't. I will though.
Okay. And how old are you?
46.
46. Okay. And then how long have you been having these concerns?
In my 30s.
Okay.
With the abnormal pap smear. She was born when I was 30. I had concerns around the time she was born, when my son was born. Pap smear has never been normal. They did the colposcopy, it's concerning. They did the mammogram, it's concerning. I have to follow up,
Okay.
And when this came up, it's forcing me to focus on me too.
Mm-hmm.
But I want to know, is that cancer concerning to you guys or?
Well, we'll see. I'll do a physical exam on her and then we'll go from there. But just curious also for yourself, the breast, do you have breast cancer or is there just concern?
Concerns.
Okay. And then also for your brother, he had colon cancer. Who else had colon cancer?
My papa, my father's father.
Your dad's dad. Okay.
He died from it, yeah.
How old was he?
In his 40s.
When he
younger
was
than him.
diagnosed?
46, he was younger. I don't know how old when he was diagnosed, but he died in his 40s. And his mama also breast cancer. She died in her 40s. And my mama's mama died in her 40s as well from breast cancer.
Okay. So yeah, I
And
mean,
her grandmother, her father's mother, passed from breast cancer.
her father's mom. Okay.
Yes, she had breast and uterus,
Mhm.
had complete mastectomy and hysterectomy. Went into remission for years. It came back again and spread everywhere. She died.
And in their 40s also.
She was older. How old was grandmama? Like 80s. She was in her 80s.
She was diagnosed in the 80s.
She was diagnosed in her 40s, but it was the sickness through for a very long time. She went into remission for like 10 years.
Okay.
But when it came back, it had spread everywhere.
Okay. Do you have any brothers or sisters?
Brother.
Does he have any medical issues?
Nothing we know of. Well, asthmatic from birth.
Okay.
Other things, maybe depression, because we're all depressive in the family.
Okay.
I mean, confirmed, diagnosed, and treatment. She's on medication, so am I, so is the father. The brother is not, because he hasn't been diagnosed, but most likely he is too.
Okay. But just to go back to like the multiple cancers in the family, I mean, the reason that we ask and say that you should get tested is because like genetic cancers can be genetic, especially like breast cancer, colon cancer, and especially because unfortunately your brother was very young when he passed away from colon cancer. That's
Right.
not something that we see in children commonly.
Right.
Okay.
Mm-hmm.
Like colon cancer in a child is not normal.
It's
Okay.
not. That's what they said. They were like, it's an old old man disease. And
Yes,
it
you
was
see it.
at the time, it was very concerning for him to even have that.